Hi, I am Peter Ben Embarek, a food safety scientist at the World Health Organization, WHO, currently part of the international response to the new disease COVID-19 caused by the coronavirus SARS-CoV-2, IAmA. How worried should we be about the coronavirus? Each time a new disease emerges, make people sick, some seriously, and kill some people, we should be worried. However, we cannot predict how each of these diseases evolves. Some like SARS disappeared after 6 months. Others can be much more severe. But often, overreacting and panic can cause more harm than the disease itself. This one, like many other respiratory diseases, can best be avoided by applying basic good gesture in our daily life. Do you think that it's worrying seeing the vastly different speculations issued by experts when discussing the eventual culmination/risks of the virus? It is normal. Nobody can predict the future or how it will evolve. In a fast-evolving event, it is not surprising to see divergent predictions and modelization results. What's the possibility of food being contaminated by the virus if you live in an area with known coronavirus cases? Very low probability. This virus, like other coronaviruses, can persist/survive on surfaces, door handle, elevator buttons, handrails, etc. And also on foods if an infected person transfers the virus inadvertently to these surfaces. But it will not survive long. A few minutes to a few days, depending on combination of temperature, humidity and light. On foods, it will not survive usual cooking temperatures. Surviving on a surface for up to a few days sounds terrifying actually. That is in extreme cases, mostly we are talking about minutes to hours. As you've mentioned food. I've read a forwarded message in WhatsApp from a doctor who said any kind of cold drinks, ice cream, any kind of preserved food, milkshakes, ice etc. should be avoided. So my question is, such food should we avoid? And if answer is yes, then why? Tia. I love ice cream and shakes. Everything in moderation is always a good approach to choosing your diet. I would not know why there should be a link between these foods and the virus. It does not make much sense. Inform you via trusted sources, not forwarded messages. What needs to be done in order to eradicate this virus? This is what the world is trying to do now. 1. Identify and treat cases. 2. Identify their close contacts and follow these contacts for sign of symptoms. 3. For each contact that becomes sick and is confirmed to be infected, repeat 1 and 2. It is about breaking chains of transmissions. The more cases and the more chains of transmissions, the more difficult it becomes. It worked in 2003 with SARS after 6 months. What are some of the major myths surrounding COVID-19 that you would like to dispel? Look at top right corner of this video. One of the entries says you should practice good oral hygiene without explaining what that means. It is not obvious to many people, I'm sure. Edit. Actually it was respiratory hygiene, which is even less obvious than oral hygiene. How did you get into this? How did you know that this was the career for you, and what was your career path? When I decided on my studies, I wanted to work with something concrete. Food production was an obvious choice. I did not want to work with virtual issues like finance, bank, or the like. Nothing wrong with it, just not me. Then while studying food science and nutrition, I opted for food safety. Then I got a chance to work with international organizations, and what started as an initial 3 years project abroad, ended up as a lifetime path. I'm curious about the origins of this new virus. Is it related to an old virus? Supposedly it started at a food market. What does that mean? Why/how is that relevant? Do viruses like food or something? Assume I am totally ignorant to this whole topic, THX. This virus belonged to a group of viruses that is found in bats. This is their ecological reservoir or niche. Once in a while, they manage to adapt to another animal species through mutations and then from there, adapt to humans. We saw this scenario with SARS in 2003 with palmed civet cats as the intermediary host. Civet cats were farmed for food, so they were sold in markets. In the current case, a number of the first case identified had a link to a wholesale market, so it is believed that a similar scenario has also happened here. But this time, the animal source has not yet been identified. What are the chances of survival of the coronavirus? How is it treated? Extremely good. Most people will only experience a relatively mild disease. But even a small proportion of severe cases can give substantial numbers when the affected population is very large. First of all, thanks so much for doing an IAmA. I'm wondering exactly how worried we should be. It seems like there has been a lot of inaccurate data reported, and perhaps this is far worse than the public is led to believe. Thank you. A new emerging disease is always something to take seriously. Follow our daily update for the most accurate info and analysis available. Link. What's the latest on the suspected fatality rate of COVID-19? It's been confusing because we get numbers on confirmed cases, but those are likely only the worst, most obvious cases, when fatality's denominator is all people who catch it. Good question. Since it appears that the vast majority of cases remain mild, a number of cases are probably missed. What precautionary measures do you recommend for those in outbreak areas, as well as everyone else? Is this virus something the average person should be concerned about, beyond being informed enough to help avoid its spread and recognizing the symptoms? Follow the recommendation of your local public health authorities. They will always be the best informed about the local situation. Otherwise, you are right, being well informed via trusted sources and mainstream media is recommended. How likely will COVID-19 evolve to be lethal to humans? Nobody can predict how viruses evolve. Seeing as you work for the WHO, what do you think of anti-vax? In my opinion, they're problematic. Off topic, but in my opinion, they have not understand it. Vaccination has two functions. One, to protect an individual against a serious disease, and two, to keep the disease from getting a grip in a population. As long as approximately 80 to 90% of a population is vaccinated, it works. It also allows for a few individuals not to be vaccinated either by omission or due to medical conditions or similar reasons. But if a substantial fraction of a population does not get vaccinated, then suddenly, the disease can start spreading among the non-vaccinated. There are enough bodies to sustain the spread of the disease. Vaccines has saved millions of lives. True or false? 1. Asians are genetically predisposed to COVID. 2. Men are infected at a higher rate than women. 3. Children are less impacted. 4. Airborne and non-aerosol dry air. 5. R0 greater than 5. 6. Catching it and recovering does not confer immunity, and repeat infection is worse, plus regular flu is still coming. 7. This is likely to sustain community transmission in the absence of a viable vaccine. 8. Some HIV retrovirals have proven effective. 9. High rates of infected healthcare worker infections. 10. Mutation has the potential to make this much worse. I'm not the op, but I am a viral immunologist, and there seems to be a fair amount of interest in this. I'll try to answer the ones I can. 1. There's no real evidence that Asian people are genetically more susceptible to this virus. This hypothesis is driven more by wishful thinking than it is by a realistic possibility that this is true. 2. The numbers that have been released by China have more men being infected and dying. Their numbers are probably incomplete due to the healthcare system being overwhelmed, and let's be real, they might also still be trying to downplay this. But in general, men are more susceptible to pathogens and cancer, while women are more likely to suffer from autoimmune diseases. Testosterone is an immune suppressant. 3. The numbers that have been released suggest that children are less affected. But again, these numbers are probably incomplete. 4. The R0 value estimates range from around 2 to 4. It's important to keep in mind that that value doesn't just rely on the virus itself. The quarantine measures in place should reduce that value. In contrast, being stuck on a cruise ship is probably inflating that number beyond what you would expect in any other community. 5. We don't have very solid answers yet on the mode of transmission. But it has been suggested that it can be transmitted by aerosolized droplets, like a sneeze, not like free-floating virus just wafting around in the air willy-nilly from someone walking through the room. 6. We have no idea if people who recover will be protected from future infection with the same virus. It's much too soon to tell. 7. This virus is plenty infectious enough to maintain community transmission if left unchecked. We're doing our best to not leave it unchecked by quarantining people and tracking the people they've been in contact with. The jury's still out on how good a job we end up doing with that. 8. As far as I'm aware, only one patient was treated with HIV antivirals, so it's impossible to say for sure if the treatment was actually successful or if they just got better on their own. Even if it is successful, it's not like we have a stockpile of HIV drugs ready to go for an unexpected extra 60,000 plus patients, so that probably won't be a viable solution to this outbreak in the short term. 9. This seems to be true, unfortunately. Even with taking all the right precautions, anyone who is surrounded by the virus all day during long and busy shifts is gonna have a high risk of being exposed. 10. I can't rule out the possibility that the virus mutates to be worse. Viruses are unpredictable. But I don't think it's super likely. Viruses don't want to kill you, they want to spread to as many hosts as possible. Viruses that make the jump from animals to humans tend to be much more lethal than viruses that have been adapted to humans for a long time because they don't know that they're supposed to care about keeping their human host alive longer. If the virus does mutate, I would expect it to become more transmissible but less lethal. What do you think about coronavirus? Leave a comment. And subscribe to this channel, if you want to see more same videos.